Who here uses assistive technology? Let me see a show of hands. I can't see that many. I was like you. I've been working in global development for the past 20 years at country level, global level, with the UN, NGOs, the private sector, many different fields. But until 2 years ago, I had never heard of assistive technology. Yet, I've been a user of assistive technology for a long time. Can you guess what that is? These, my glasses. That is the most common form of assistive technology. Think of your smartphone. Do you use captioning on your smartphone? Do you sometimes leave voice messages instead of writing text on WhatsApp? If we're fortunate to live long enough lives, we probably will all end up being AT users. We may need a wheelchair to get around, or a walking stick, or hearing aids. Assistive technology, also known as AT, concerns all of us. Here in Switzerland and in Europe, things function pretty well because most people who need assistive technology can access it. It's sometimes free of charge, or covered by your health insurance or social benefits. We don't think twice about it. But imagine a world where that is not the reality, where access to assistive technology is not so straightforward. Just imagine if you walk up to your bus in the morning and the bus driver says, "Sorry, I can't take you to work today. I broke my glasses and there's no replacement. I can't see to drive." I couldn't function without my eyeglasses. I couldn't do so many things that I take for granted. Drive my car, go to the movies, do the job that I do. In fact, if I hadn't been tested and provided with eyeglasses when I was a teenager, I probably wouldn't have been able to finish school. It is a harsh world when you can't see, hear, or move around. Think of a child living with a disability who doesn't have access to assistive technology, can't get out of the house, can't go out and play with friends, will struggle to get through school, let alone reach the school. Think of an adult that needs a wheelchair, doesn't have it. Not easy to get a job if you can't leave the house. And then you're dependent on your family members. And the mental health impact also of this lack of autonomy and this exclusion from society is significant. Yet that's the reality today for millions of people in the world. Just last year, I was in Tajikistan for work, and I met a remarkable man, Kulumali Nazarov, also known as Roland to his friends and colleagues. We took a car down to the south of the country in a remote town to visit Roland, who was managing an assistive technology center in a primary health care facility, the first of its kind in Tajikistan. And we were going there to discuss the possibility to scale that up across the country. Roland was himself an AT user. He was born without legs and an impaired hand. He came from a very poor family. It didn't have access to assistive technology when he was growing up. In fact, it wasn't until he was 10 and was sent to a boarding school that he got his first wheelchair. Roland had a real knack for fixing things, and he really became adept at fixing wheelchairs, and he was noticed by the World Health Organization at a workshop for his skills, and bit by bit, he became their assistive technology expert in Tajikistan. Now, what really struck me when I met Roland was not just how remarkable he was because of the job he was doing and how good he was at it, but it really drove home that transformative power of assistive technology that enabled him to do what he was so good at doing. And that in turn, he then impacted countless others through the rehabilitative services and assistive technology he was helping access. Sadly, Roland passed away shortly after we met in a tragic accident. But his legacy, I'm sure, will live on in Tajikistan. Now, roll-on is one example, but there are 2.5 billion people in the world today that need one form of assistive technology or another. That's a third of the world's population. And that number is growing. With aging and the rise of non-communicable diseases like diabetes, the needs keep on growing. In high-income countries, 80 to 90% of people who need assistive technology can access it. In low-income countries, that number goes down. It goes down, it goes down, it goes down to about 10%. And in some countries, it's as low as 3%. Now that inequity, that's unacceptable. In today's world, that is just unacceptable. A few years ago, we adopted the Sustainable Development Goals. I'm sure you've all heard of them. One of the fundamental principles of the Sustainable Development Goals is to leave no one behind. Now let me ask you this. How can we ever reach those goals if we can't have truly inclusive societies that leave no one behind? And how can we have truly inclusive societies if we can't provide the most basic forms of assistive technology to those who need it, to those who are entitled to it? That's right. AT is a basic human right. It's a moral imperative that we have to address this inequity today. We're failing millions of people. Why is that? There's a couple of reasons. One is lack of awareness and understanding for AT. There's a lot of stigma associated to disability and the use of assistive technology. Governments aren't living up to their obligations. Most countries have signed the Convention for the Rights of People Living with Disabilities, but very few are implementing their commitments. Products are not adapted to all settings, and they're very expensive. Financing is a major issue. Health insurance and government budgets don't cover this in lower income countries, and philanthropy is nowhere to be seen in this space. Human resources are missing. In some countries, you'll find one audiologist for the entire country. Supply chains aren't working. I could go on and on. But the good news is that we have faced similar challenges before, and we have been able to overcome them. Think of the Global Fund to fight AIDS, TB, and malaria, based right here in Geneva. Over the last 20 years, 50 million lives saved by making more accessible and affordable antiretroviral treatment available. Think of Gavi, the Vaccine Alliance, also here in Geneva. 15 million deaths averted over the last 20 years by making vaccines more accessible and affordable in lower income countries. And that's exactly what ATscale, the Global Partnership for Assistive Technology, aims to do. By 2030, ATscale aims to ensure that 500 million people are reached with assistive technology. That's a big number. It's a big, bold, ambitious goal. How is that going to actually happen? Well, learning from other experiences. Collective action. We all need to come together. AT users, organizations of people with disabilities, governments, the private sector, innovators, investors, academic, research institutions. We all need to come together and agree on a common goal and put all of our resources behind that. Secondly, win-win solutions. We need to find solutions that work for businesses, that work for governments, that work for individuals that need assistive technology. We need to put in place healthier markets that make these products more affordable and accessible everywhere. Thirdly, the systemic barriers that persist. I mentioned stigma, human resource challenges, antiquated policies. We need to fix those systemic barriers. And last but not least, a change of mindset. AT is not just a nice to have. AT is a moral imperative and a moral obligation, not to mention all the social and economic benefits that AT brings to society. So this movement that I'm talking about, it starts here. It starts with you, with all of us. We can all play a part. What can you do? Well, talk about it. Talk to your family, talk to your friends, talk to your colleagues. Express your outrage on social media. Ask your local politicians what they're doing about this. In your workplace or in your schools, make sure that the environments are inclusive, are accessible, and that the needs of assistive technology are being catered for. AT cuts across all sectors: health, education, the environment, livelihoods, humanitarian responses and conflict. If you're working in any of those spaces, make sure that the programs are inclusive and that the needs of assistive technology are being planned for. Together, we can transform the lives of millions of people through assistive technology. 500 million people. Thank you.